Mr. President.
Senator from Rhode Island.
Mr. President, I would ask to dispense with calling the quorum.
Without objection.
Thank you, Mr. President. Mr. President, I am truly dismayed by what we've seen in the chamber over the last couple of months with respect to the Senate Trumpcare Bill. We are expecting to take a vote tomorrow on the motion to proceed, but at this point, our Republican colleagues haven't shared with us exactly what we're proceeding to. We don't know if our Republican colleagues will attempt to replace the ACA with their flawed Trumpcare bill, or if they will just vote to repeal the ACA and immediately upend health insurance markets across the country. Not one of these options is acceptable, and I am skeptical that my colleagues will be able to come up with a better solution in the next 24 hours. For an issue of this magnitude, we should be holding hearings, meetings, and discussions in the committees of jurisdiction with experts from around the country, much like we did when we worked to pass the Affordable Care Act. In that way, we could have worked together across the aisle to develop ideas that would improve the system in place, not gut it. There have long been misconceptions about how the Affordable Care Act came to be. We held hearings, meetings, and roundtable discussions for over a year with members from both parties and had a robust amendment process in our committees, both the Senate's Finance Committee and the Health, Education, Labor, and Pensions Committee. And I served on the Health Committee at that time and went through numerous hearings, open discussions, numerous amendments, listening to my colleagues. In fact, the Health Committee draft of the ACA included over 160 amendments offered by my Republican colleagues. It was truly a bipartisan effort at the committee level to try to at least discuss the critical issues that both sides had identified. And this stands in stark contrast to the bill our colleagues have written in secret this year. Even some Republican senators were kept in the dark, excluded from the process. There were no opportunities for experts, doctors, patients, and others to weigh in and offer comments. As a result, they have written a bill that is bad for patients, bad for health care, bad for states, and bad for the system as a whole. My colleagues even rejected the chance to hear from states in public hearings about their health care systems in terms of what has worked well and what hasn't. And there are examples of states that have done some very innovative things and some examples of states who have difficulties. We always say that the states are the great incubators for new ideas, yet the process that was adopted did not incorporate their views, in both the cases where they did remarkably well and in cases where, frankly, we could do much better. We should look to the states to see how we can improve our health care system and let them be partners with us in this process. That's what we did during consideration of the Affordable Care Act. In fact, some states had already worked to expand access to care before the ACA, most notably Massachusetts with Romney Care. And we look carefully at those examples and try to incorporate those successful ideas in our national model. By contrast, governors and senators and state legislators and state representatives, both Democrats and Republicans across the country, are largely opposed to the Senate Republican Trumpcare Bill because they know it would be a bad idea for their states. State and local officials have crossed party lines and joined together to get the word out about how bad this bill would be for Americans from all states and all walks of life. My Republican colleagues must heed their advice and abandon this harmful approach. It's no secret why my Republican colleagues have struggled to come up with the votes within their caucus for their repeal efforts. Their proposals are bad for my state of Rhode Island and bad for the country as a whole. In fact, many states with Republican legislatures and Republican governors have done very well in incorporating the ACA, and they can understand the impact it will have almost immediately on their health care system. Now, while we don't know exactly what we'll be voting on tomorrow, we have some guesses based on some of what Republicans have publicly shared over the last couple of weeks. Each proposal seems to be worse than the next. First, my colleagues tried to vote on their Trumpcare bill, which would have provided massive tax giveaways to the very wealthiest Americans at the expense of hardworking Americans across the country. This bill would have decimated Medicaid, cutting state budgets and eliminating access to care for seniors, children, and people with disabilities. 60% of the funds in my state, and it's roughly equivalent across the country, go to seniors, typically seniors in nursing homes through Medicaid. And if they lost that funding, the states can't make it up. I think every state in this country is struggling with their own fiscal issues, education, transportation infrastructure, a host of issues. And when this money is pulled out, they will not be able to replace it. They will make difficult decisions about cutting back eligibility so that, and ironically, so that middle class seniors will be the first to feel the brunt of these cuts. That's exactly one of the areas where we're trying to improve our system, not only of healthcare, but of government. And even after doing that, they'll still, I think, come up short, and that's when they'll go into the education funding formulas. And there are many states across this country now that are already in crisis. This would just add to the crisis. But all of these fixes will, I don't think, overcome the damage that would be inflicted by the bill. Now, the Nonpartisan Congressional Budget Office confirmed last week releasing an updated score of the bill to reflect some of the changes that they made. CBO said that under this revised bill, the latest one that's been evaluated, 22 million Americans will lose coverage, just like the previous version of the bill. 22 million Americans, a significant number of our neighbors would lose their coverage, many of them working families, many of them who have children with special needs who need this coverage, and they would be thrown out. I was at a Lowe's store in Rhode Island. A young man came up to me, probably mid-30s, and said, "Please, Senator, you've got to stop this bill. I have a son that has a serious problem." I believe he told me it was MS. He said, if eventually they remove the lifetime limits, as they're talking about, on health care insurance, I will be done. I've got employer health care insurance. I've got a good job. I've got benefits. But if they put those lifetime limits back again, I'll be bankrupt. My son will not have the care, or he'll only get the care through some type of some extraordinary method. And that's the reality. These are our neighbors. And then similarly, CBO said that out-of-pocket costs would increase across the board, and care would be prohibitively expensive for the sickest and poorest amongst us. And that is one of the great ironies here. The sickest would be paying more and more and more. CBO was not misled by these so-called fixes that have come into the bill. In fact, we know that the reality would be even worse than I believe CBO predicted, because it did not take into account a provision added too late to be scored, which would bifurcate insurance markets, separating the sick from the healthy, leading to a death spiral in a market that would all but certainly collapse the market. Plans that are sort of, they're not really insurance, they're kind of, I don't know what they are. In fact, CBO couldn't even call them insurance. But that would qualify as a plan. The healthiest, youngest people would buy it because it's cheap and they have some kind of sense of protection, driving the sickest and older people into other plans, increasing their costs, and in fact, creating this bifurcated system where either young, healthy people don't have insurance, or they have this insurance which is not insurance when you need it, and then you'd have more and more people with chronic conditions and illnesses and just the accumulated health issues of age flocking to what is left and bringing that system down. It would be a death spiral. And if that wasn't bad enough, some of my colleagues on the other side of the aisle decided that the backup plan would be to vote on a bill to repeal the ACA in its entirety on a 2-year delay. They claim that will give them an opportunity to work out a replacement plan. This is not sound policy. First, they've had more than 7 years to come up with a replacement without any success. At this moment, there's this ad hoc, what do we put in, what do we take out? 7 years of supposed study and analysis has produced apparently nothing. And they've spent all of this year behind the closed doors coming up with something that they think will work, but they've come up with the same failure results, the same CBO scores, basically. So the real end game is not to repeal and replace. It seems to be just to repeal. And my other concern is, if this repeal, even if it's delayed 2 years, markets will not wait 2 years to react. Insurance companies will not wait 2 years to react. They have to provide for decades in terms of actuarial values, in terms of their shareholders. Hospitals will not wait 2 years. They will see this coming to an end. They will start scaling back their programs, their outreach, all of the things they do. And the effects will be imminent. So this effort will leave 17 more Americans uninsured next year and 32 million more Americans uninsured over the next decade. That is the repeal and wait approach. And once again, this CBO said that this repeal bill would lead to skyrocketing health care costs. For the reasons I suggest, markets will not wait. Markets will move very quickly once they know that this is gone. And since in the last 7 years we couldn't get a replacement, the idea we're going to get in 2 more years is something that they won't believe. And it'll be immediate and devastating in many respects. Again, another death spiral for the marketplace. But here we are on the precipice of voting over whether or not to upend our entire healthcare system so that, in some respects, this president can claim a victory over former President Obama. Not because it's sound healthcare policy, but just because of that very complicated relationship. And it's not the right thing to do. It's long past time for us to leave the campaign rhetoric behind, to get together in a bipartisan fashion to work out ways to improve our healthcare system. That is what we attempted to do in the ACA. We set for the meeting after meeting, hearing after hearing, longest markup, I believe, in the history of the Health Committee, accepting and voting on Republican amendments and Democratic amendments. That's how you get things done. I hope that's how you get things done. Healthcare makes up 1/6 of our economy. And when you walk into an ER or doctor's office, they don't ask you whether you're a Republican or Democrat, but it does matter if you have insurance. That's the only question they ask. How are you paid for this? And if you don't have insurance, then you're in an awfully difficult position, and we know that. And everybody is going to use the healthcare system in their life. This is not an optional thing. This is not something it's designed for a special group of people. We all will use the healthcare system. And if you can't access it because you have no money or no insurance, maybe you'll find a way through the emergency room or some other way, but it won't be the best health care, and it won't be the most efficient and economical for our country. In fact, one of the ironies of our healthcare system before the ACA is that you could have large portions of our populations with no health insurance, not getting treatment for illnesses that could have been readily fixed while they were in their 40s and 50s, and then suddenly at 65, with Medicare, which we all support, any kind of treatment they want. I had ophthalmologists in my office one day, and I made this point, and they kind of looked around and commented, well, you know, right, because I see right now people coming into Medicare, 65, 66 years old, because they had adult onset diabetes, which could have been treated by a modest drug regime when they're in their 40s or 50s. They're now so sick that they have to have expensive ophthalmological surgery. That's not effective for the country. With the Affordable Care Act, we were putting our whole nation, we hope, from young people, children, all the way through on a path to good health care. So by the time they get to Medicare, those issues would not be so pertinent. So I would urge my colleagues to abandon this effort, to begin tomorrow not with a vote on their proposal, but on sitting down with both sides, doing the same process that we did. Again, one of the the test of life is, do you do what, or allow your colleagues and friends to do what you did, or do you insist they do something else? We're just asking you to do the same thing we did with the Affordable Care Act. Over many months of hearings and debate, and then at the end, there was a vote. We're going to see this for the first time tomorrow. The details, we still don't know what's going to be in it. And there'll be a vote, but it won't be an informed vote. It won't be the result of careful deliberation. It won't be a result of bipartisan effort. It won't be a result of all the equity holders, doctors, patients, public health officials, governors, coming together and saying, we can do this better. And that, to me, is a shame. And with that, Mr. President, I would yield the floor. And I would also note the absence of quorum.
Clerk will call the roll.